Have you ever found yourself lying awake at night, watching the clock tick by, wondering when you'll finally fall asleep? It's a common issue many face as we age, but the good news is that there are natural ways to improve sleep quality. If you're tired of waking up multiple times during the night or struggling to fall asleep, you're not alone. Sleep patterns often change with age, but that doesn't mean you can't regain control over your rest. Let's explore simple, natural approaches to help you sleep better, starting tonight. The first step to improving your sleep is creating a consistent sleep schedule. It's easy to get caught up in late-night activities or sleeping on weekends, but this inconsistency can throw off your body's internal clock, known as the circadian rhythm. A regular bedtime and wake-up time can make a huge difference. When you stick to a schedule, your body knows when to wind down and when to wake up, which makes it easier to fall asleep and wake up feeling refreshed. Try to go to bed and wake up at the same time every day, even on weekends. It might take a few weeks for your body to adjust, but it will be worth it. Next, let's talk about establishing a bedtime routine. Creating a calming pre-sleep ritual can signal to your body that it's time to wind down and prepare for rest. A relaxing routine might include a warm bath or shower, reading a book, or listening to soft music. Avoid stimulating activities such as watching TV or checking your phone, as the blue light emitted from screens can interfere with melatonin production, which is essential for falling asleep. Instead, dim the lights, put away your electronics, and opt for relaxing activities that help your mind and body prepare for sleep. Your sleep environment plays a significant role in how well you sleep. Ideally, your bedroom should be quiet, dark, and cool. A cool room temperature between 60 to 67 degrees Fahrenheit, 15 to 20 degrees Celsius, promotes restful sleep because it helps your body lower its core temperature, which naturally occurs when we sleep. If your room is too warm, try using a fan or adjusting your bedding. Make sure your bedroom is as dark as possible, since light, whether from street lamps, electronics, or even moonlight, can disrupt your sleep cycle. Consider using blackout curtains or an eye mask to block out light. If noise is an issue, a white noise machine or earplugs can help create a peaceful sleep environment. Lastly, make sure your mattress and pillows are comfortable. Over time, mattresses can lose their support, and pillows can lose their shape. If yours are old or uncomfortable, consider replacing them to ensure your body has the support it needs while you sleep. Now that we've discussed your sleep environment and routine, let's move on to eating habits. Eating too close to bedtime can lead to discomfort and disrupt your sleep. Heavy meals, spicy foods, or large quantities of food can cause indigestion, making it difficult to fall asleep. Try to finish eating at least 2 to 3 hours before bed to allow your body time to digest. If you're hungry before bed, opt for a light snack like a banana, a handful of almonds, or a small bowl of yogurt. These foods are easy on your digestive system and can even help promote better sleep. Bananas are rich in magnesium, which can help relax your muscles, while yogurt contains calcium, which plays a role in melatonin production. Lastly, let's talk about avoiding late-night screen time. Many of us are guilty of scrolling through our phones or watching TV before bed. While it may feel relaxing at the moment, the blue light emitted by screens can actually mess with your melatonin levels. Melatonin is a hormone that signals to your brain that it's time to sleep, and too much screen time before bed can prevent your body from producing enough of it. Try turning off all electronics at least 30 minutes before you plan to sleep. Instead, consider doing something relaxing like reading a physical book or listening to soothing music. By making these simple changes, setting a consistent sleep schedule, creating a calming bedtime routine, optimizing your sleep environment, and being mindful of eating and screen time, you'll be well on your way to better sleep. Remember, improving your sleep takes time, so be patient with yourself. It's all about making small, consistent changes that add up over time. Creating a good sleep routine doesn't happen overnight, but with time and a little effort, you'll find yourself waking up feeling more rested and ready to take on the day. Stay tuned, because in the next part, we'll dive deeper into other habits that can help you achieve more restful sleep, starting during the daytime. Now, let's focus on a few more habits that can make a big difference in the quality of your sleep. One of the most powerful tools for improving sleep is getting natural sunlight during the day. You might wonder how sunlight could impact your sleep, but it's actually key to regulating your body's internal clock, known as your circadian rhythm. The more sunlight you get, especially in the morning, the better your body can understand when it's time to wake up and when to wind down at night. Just a short walk outdoors each day can help synchronize your body's sleep-wake cycle. If you're unable to get outside due to weather or other reasons, a light therapy box can also provide the necessary exposure to light to help reset your rhythm. Next, exercise is another crucial element for better sleep. Regular physical activity helps tire your body out, making it easier to fall asleep and stay asleep. Whether it's a gentle walk, swimming, or yoga, moving your body during the day contributes to more restful sleep. But timing matters. Try to finish exercise at least 3 hours before bed. While a workout might help you feel tired, exercising too close to bedtime can have the opposite effect, leaving you too energized to sleep. Find a routine that works for you and try to stick with it. Caffeine and alcohol are both substances that can disrupt your sleep. Caffeine, found in coffee, tea, and some sodas, is a stimulant that can keep you awake long after you've had your last cup. Even if you're used to drinking coffee in the afternoon, it could still be interfering with your ability to fall asleep. Try to limit caffeine intake after 2 or 3 p.m., especially if you have trouble sleeping. Instead, consider switching to herbal teas, like chamomile or peppermint, which are naturally calming and can aid relaxation. As for alcohol, while it may initially make you feel drowsy, it actually disrupts your sleep cycles. You might sleep deeply at first, but alcohol can cause you to wake up frequently throughout the night, leaving you feeling unrest. If you enjoy a drink, try having it earlier in the evening, so it doesn't interfere with your sleep. Stress and anxiety are also big culprits when it comes to poor sleep. Managing stress is crucial for improving your sleep quality. A busy mind can keep you awake, racing through thoughts and worries. One great way to counter this is by practicing relaxation techniques before bed. Deep breathing exercises or meditation can calm your mind and relax your body. Even spending a few minutes each night focusing on your breath can lower your heart rate and prepare your body for sleep. You might also try progressive muscle relaxation, where you tense and then release each muscle group, starting from your toes and moving up to your head. It's a simple but effective way to release physical tension and promote a feeling of relaxation. All of these lifestyle habits, getting sunlight, exercising regularly, cutting back on caffeine and alcohol, and managing stress, can help create the ideal conditions for restful sleep. The key is consistency. You may not see immediate results, but with time, these small adjustments will add up to big changes in how well you sleep. Remember, the goal is to create an environment and a daily routine that supports your body's natural sleep rhythms. When you make these positive changes, you'll start to notice improvements in both how quickly you fall asleep and how rested you feel when you wake up. By now, we've covered a lot of ground, setting a routine, adjusting your lifestyle, and making changes to improve your sleep quality. But what happens if you've done everything right and sleep disruptions still creep in? It's not uncommon, especially as we age, and it can feel frustrating. Don't worry though. There are still a few strategies you can try to work through these issues and get back to a better night's rest. First, let's talk about wakefulness during the night. If you find yourself waking up in the middle of the night and not being able to fall back asleep, try not to stress. It's easy to let frustration build when you can't sleep, but that anxiety can actually make things worse. Instead of looking at the clock and worrying about how many hours you have left to sleep, focus on relaxation. Calm your mind by taking slow, deep breaths or practicing a simple mindfulness exercise. Just bringing your awareness to your breathing or imagining a peaceful place can ease that feeling of restlessness. Sometimes, nocturia, the need to get up and use the bathroom during the night, can be a significant sleep disruptor. This is more common as we get older, and it's understandable that getting up frequently can break your sleep cycle. If this is a problem for you, try to limit fluid intake an hour or two before bed. While it's important to stay hydrated, reducing fluids close to bedtime can minimize those nighttime trips. You can also try a nighttime routine that involves going to the bathroom right before bed and perhaps using dim lighting to avoid fully waking yourself up during those trips. Another common issue is sleep apnea, which is when your breathing temporarily stops during sleep. If you find that you're often waking up feeling unrefreshed, or if you or a partner notices loud snoring or gasping for air during the night, it might be worth discussing with a doctor. Sleep apnea is treatable, and getting the right help can significantly improve your sleep quality. If you haven't already, consider talking to your healthcare provider about possible solutions. Sometimes, sleep disruptions aren't due to physical reasons, but more related to emotional or mental health. Anxiety and depression can interfere with sleep patterns, often causing you to lie awake, feeling restless or uneasy. If you find that emotional stress is affecting your sleep, it's important to reach out for support, whether through therapy, talking with a loved one, or engaging in activities that relieve stress. It's vital to address these underlying causes. If you've tried adjusting your routine and these disruptions are still an issue, it might be time to talk to a healthcare professional. Sometimes sleep issues may be tied to other medical conditions, and getting an accurate diagnosis can be the first step in resolving them. The key to overcoming sleep disruptions is patience and persistence. While you may not see immediate results, making consistent, small changes will help you build healthier sleep habits over time. Whether it's adjusting your bedtime routine, finding the right relaxation techniques, or seeking medical advice when necessary, taking a proactive approach will improve your overall sleep quality. And remember, you're not alone. Sleep changes with age are natural, but with the right strategies, you can still enjoy a restful night's sleep and wake up feeling refreshed and ready to tackle the day.